Hello everybody, welcome back to Remedy OMM. Today, we are going to go over some board-style questions to practice what we learned in Lecture 1. If you struggle with the basics of naming somatic dysfunctions and Fryette's principles, I recommend watching that video first before attempting these questions. I have 5 questions prepared. I didn't add any fluff that you normally find in COMLEX questions, but I believe these questions will cover the topic thoroughly. With that being said, let's dive right in. Question number 1. A 19-year-old male presents to clinic with a complaint of back pain. History reveals he suffered trauma to the back while playing basketball. Osteopathic structural exam reveals the right transverse process of T7 to be more posterior than the left. This finding becomes more asymmetrical during extension at the waist. What is the most likely diagnosis? Looking at the answer choices, it seems they want us to name the somatic dysfunction, so let's find what we know. Osteopathic structural exam reveals the right transverse process of T7 to be more posterior than the left. Okay, so let's imagine T7 right here, and we'll label it T7, and we know that this is the posterior side of the patient. Imagine him lying on his back, and this here is the anterior side. So if the right transverse process is more posterior than the left, then T7 must look like this, which means we are rotated to the right. So we have T7 rotated right. Next we see that rotation gets worse during extension. Worse is not good, so that means the patient prefers the opposite, which of course is flexion. So we have T7 flexed, rotated right, and flexion means type 2. Type 2, two are the same, so side bending occurs in the same direction. Therefore the patient is side bent right. So C is the right answer here. Pretty easy once you work through it, and with practice, you'll be able to get these kinds of questions very quickly. Let's look at the next example. Question 2. A patient presents with back pain. Osteopathic exam reveals that the transverse process of T9 is more anterior on the left than the right side. When the patient flexes at the waist, the asymmetry remains unchanged. Which of the following is the most likely diagnosis? And here's our answer choices. Okay, so we know we have transverse process on T9 more anterior on the left. Same as last question. We are rotated right, but this time we have no change with flexion, which means T9 must be in a neutral position. So not A, not B. Here we have a T9 neutral, but rotated the wrong way, so not C. And this answer choice shows flexion, so that can't be right, which leaves us with E. Now recall, neutral dysfunctions are type 1, and type 1 dysfunctions tend to be group dysfunctions. Does T9 fall within this range? It sure does. So we circle E and we move on. Question 3. A 30-year-old presents to the office with complaints of upper back pain. Osteopathic structural examination of the patient's thoracic region reveals a band of hypertonicity of muscles on the left. Further examination reveals posterior transverse process on the right from T3 to T6 using Fryette's principles. Which of the following is true regarding the somatic dysfunction presented above? Okay, so before I dive into the answer choices, let me figure out what I know. So we have transverse process of T3 to T6 more posterior on the right. So that means we are rotated right. And we have T3 to T6 with no clues as to how changes in flexion or extension affect the spine. Well, since they are giving us a group, we could say that this is probably neutral and rotated right. So that means that we're type 1, which means we must also be side bent left. Okay, now looking at the answers, we can see that given what we found out, we can rule out B. Answers A and C both talk about convexity, so let's look into that. Here's an image of the spine that I manipulated to show a little curve. This side here that goes in is the concave side, while the side that protrudes out is convex. In this picture, we can imagine this patient is facing away from us, so he would be side bent left, which is what we have in our patient. So A, convexity and rotation opposite sides, well, we have rotation right and convexity right, so that can't be right. Answer B, no, we are type 1, rotation and side bending are to different sides. Answer C, convexity is on the right, side bending is on the left, so that's not the correct answer. Answer D has to be the right answer. Rotation and translation to the same side. Rotation is to the right, and translation is going to be opposite direction of side bending, which is also to the right. So this is definitely the correct answer. Let's dive into translation a little bit before moving forward. Translation describes the movement of a vertebra in a transverse plane. If you imagine yourself as a practitioner trying to push this vertebra from right to left, it would move like so. This is translation. What translation tells us is how the vertebra is side bent. What you need to know is that a direction a vertebra translates with ease is opposite the direction of side bending. Or a better way to think about it is that restriction in translation is the direction that vertebra is side bent. Let's look at this example below. On the left, we have a normal stack of vertebra. On the right, we have a stack that is side bent to the right. And you can see here in this example that if we tried to translate to the right, or from left to right, that the way the vertebra is positioned will limit and restrict the translation. Whereas if we try to translate to the left, we have more freedom and ease in that direction. Question 4. A 52-year-old female presents with low back pain. Osteopathic structural exam reveals posterior transverse process on the left for T12 to L4. These segments are restricted when translating to the right. What is the most likely diagnosis? Okay, so we have T12, L4, a group dysfunction, tells us that we're probably neutral. Transverse process on the left, so we are rotated left. Since this is neutral, that means we have a type 1 dysfunction, and side bending is opposite rotation, so we are side bent right. So the answer here is A. We didn't even need to figure out the translation component on this question to figure it out. But just to confirm, restricted translation to the right means we must also be side bent right, as you can see here. You can really start to get a feel for these kinds of questions, and once you get the hang of it, you can see how quick and easy they are to answer. Next question. Question 5. A 39-year-old female presents with muscle tension in her lower back. She has tried over-the-counter anti-inflammatory medications without relief. Her vital signs reveal a blood pressure of 128/81, a pulse of 68, and an oxygen saturation of 99%. Osteopathic exam reveals T11 to be rotated right and side bent right. Flexion of the patient at the waist decreases the asymmetry. Which physical exam findings are most likely? Okay, so we have T11 this time, rotated right and side bent right. Flexion decreases the asymmetry, so that means she prefers flexion. Okay, so what physical exam findings would we notice? Well, if we are rotated right, then we know that our right transverse process is posterior and our left transverse process is anterior. So these three choices are wrong. Now the question is, which direction are we restricted? Well, if the patient prefers flexion, that must mean that they are restricted in extension. So the answer here is E. Now, before we conclude, I want to go over a few points that will save you time and help you on test day. The first point I want to make is that when it comes to your boards, and COMLEX especially, you want to read the question first. This will prime you to find the information you need throughout the question stem. I cannot tell you how much time you will save. Let me show you a quick example. Unlike before, where we read the whole question, let's look at how we can tackle this question efficiently. First, let's read the question. What would osteopathic structural exam likely reveal? Okay, so we're looking for an OMM finding. Second, let's take a quick peek at the answers, okay? These are simple findings. Looks like maybe an acute versus a chronic type of situation, given the answer choices. So now we've really primed our thoughts to look for hints in the question stem so that we can get our answer. Now with that in mind, let's read the question. A 23-year-old male presents to his free clinic with complaint of chronic neck and upper back pain. Okay, let's stop right there. Did you catch it? We can already answer this question. Keyword is right here, chronic. So in the end, this question boils down to what is a chronic OMM finding? And the answer is B, cool temperature. Simple, guys, so easy. And it took us what, seconds? Tip number 2 is to strike out answers using logic. There's a lot of answer choices that you'll come across in COMLEX that might show a type 2 dysfunction with side bending and rotation happening in different directions. Well, following Fryette's principles, that doesn't happen, at least if it's in the thoracic and lumbar spine. It's impossible. So we can use these logic tricks like that to increase our odds of getting the right answer. And my last tip, of course, practice, practice, practice. That's all I have for you guys today. These topics are super high yield. You will get questions like this on tests in school and on boards, so make sure you understand and practice. As always, thanks for watching. Please like, comment, and subscribe, and support our channel. We'll see you guys in the next lecture.